Toxoids rank among the most critical immunological products in modern pharmacy, providing long-term protection against some of the deadliest bacterial infections known to medicine. By definition, a toxoid is a bacterial toxin that has been carefully detoxified. The central biochemical challenge in creating them is clear. We must use a pathogen's lethal weapon against it without causing harm to the patient. On the left is toxicity, the biochemical ability to bind and cause structural damage. On the right is antigenicity, the unique spatial shape the immune system recognizes. Bioprocessing strips away toxicity while preserving antigenicity, tricking the body into producing specific neutralizing antibodies. This process generates active immunity, where the body forms its own memory cells for long-term protection. This is distinct from passive immunity, where pre-made antitoxin serums are injected for immediate but very short-lived defense. Standard clinical examples of this specific technology include the tetanus toxoid and the diphtheria toxoid. Taking a lethal biological weapon and re-engineering it into a safe, memory-building tool requires a precise and highly controlled manufacturing pipeline. Transforming that toxin requires a rigorous 6-step bioprocessing pipeline. Step 1 is cultivation. Manufacturers must first select a highly immunogenic, toxin-producing bacterial strain, such as Clostridium tetani. This animation tracks phase 1, cultivation. Inside an industrial bioreactor, strict controls maintain the pH, temperature, and oxygen bacteria need to multiply and secrete raw toxin. At peak levels, we reach step 2, extraction. The culture is filtered, isolating the lethal toxin. With the raw toxin isolated, the pipeline moves to step 3, detoxification. This is the most critical biochemical step in the entire process. In this visualization, formaldehyde molecules chemically bind directly to specific toxic sites on the protein. This prolonged reaction requires strict temperature controls to protect the delicate protein. Over time, formaldehyde forces the toxic domains to physically change shape and neutralize. Crucially, the outer receptor binding structure, the antigen, remains perfectly intact and identical to the lethal version. This precise chemical tagging successfully engineers a lethal molecule into a safe, trainable proxy, ready for final formulation. Before the toxoid can be used, step 4 requires purification to remove any unwanted bacterial proteins and wash away the leftover formaldehyde. This leads to step 5, adsorption. This is a critical formulation technique used to maximize the effectiveness of modern vaccines. This animation shows adsorption, where purified toxoid binds to adjuvants. Aluminum salts build a rigid, crystalline lattice structure to severely delay systemic release. Without the adjuvant, the body clears the toxoid rapidly. By forcing a slow, sustained release, the lattice heavily amplifies the prolonged immune response. Finally, step 6 is standardization and formulation. Antigen concentration is adjusted for exact potency, and the finished product is filled into sterile vials under strict aseptic conditions. Once injected into a patient, the mechanism of action begins. Antigen-presenting cells, or APCs, locate and consume the adjuvant toxoid complex. The APCs process the antigen and trigger a cellular cascade, activating CD4-positive helper T cells, which in turn activate B cells. The final immunological output is exactly what we need: the mass production of specific IgG antibodies and the formation of long-term memory cells. The physical addition of an adjuvant during absorption transforms a simple, fleeting protein into a sustained immune training event, ensuring protection that lasts for years. Because the final vaccine relies on that complex biochemical structure, the delicate protein folded onto an aluminum lattice, the finished vial is highly sensitive to thermodynamics. There is an absolute mandatory storage rule for toxoids. They must be kept between +2 and +8 degrees Celsius. This close-up highlights a vaccine vial monitor, or VVM sticker. If temperatures rise above 8 degrees, the inner square darkens, indicating heat exposure. Heat causes protein denaturation, permanently unraveling the carefully preserved antigen structure. But why is freezing, meaning temperatures dropping below 0 degrees, actually more catastrophic for an adsorbed vaccine than heat? Below 0 degrees, water forms jagged ice crystals that shatter the rigid aluminum adjuvant lattice. Upon thawing, the destroyed lattice releases the toxoid proteins, which clump into useless masses, a failure known as irreversible aggregation and precipitation. Once the adjuvant lattice is shattered by ice, it cannot be rebuilt. The loss of potency is permanent, and the vaccine will fail to protect the patient. To prevent both denaturation from heat and precipitation from freezing, the pharmaceutical industry relies on a mandatory logistical system known as the cold chain. The cold chain utilizes specialized equipment, including ice-lined refrigerators, insulated cold boxes, and continuously monitored transport to track the exact temperature of the vial from the manufacturer all the way to the patient's arm. Toxoids function by decoupling a pathogen's structure from its lethal effect. Executing that decoupling requires precise biochemical control in the lab, and delivering it requires strict thermodynamic control in the real world.